Dr. Rubio, thank you for having us here. We are
Dr. Herring, thank you for being here and come as a look at our clinic.
Yes, we are so excited to see what you're doing here at La Guadalupana Medical Clinic. And we know that this is a labor of your love as well.
It is.
And we would love to hear more about the clinic, its history, and what you're doing here.
Perfect. Well, the history of this clinic is something special. It was established in 2004, so we're going on to the 21st year anniversary coming up. It was basically established many years ago by Father Alfonso and Dr. Gabriel Umaña, family practitioners from Ocala. They put this together 20 years ago, and it was run basically inside the church until the beginning of the pandemic. Through the years, we have multiple providers coming in and out and helping, from physicians, specialists, and nurse practitioners, along all the ancillary voluntary from nursing and from staff services and everything. We've been blessed with having the church, which establishes just to keep us going. And through the church, they were able to get some money from donations and created this wonderful clinic that you guys are going to see. It was very difficult in the past. Imagine seeing patients inside the church, in the confession center, and here and there. So it was basically wide open, but people enjoy it and love it because they will getting their services done, getting the healthcare taken care.
Tell us more about what patients this clinic serves. Who comes here?
Basically, we serve underserved and uninsured patients. Vast majority of patients are Hispanic, but we got Caucasians, American too, with no insurance. And it's basically just for uninsured patients. We're trying to assure and double check the best way possible to that people with insurance will not come and take advantage of it. Because it will always happen. It had happened in the past. And after we question it and tell them our mission and vision and what we do, they're honest, tell them they have insurance, that something is going on, reason why they come in. So if the purpose is to serve an uninsured patient.
No, that's wonderful. So, as far as lab work, these type of things, does your clinic have a relationship with others in the community?
Yes. We've done all the math and numbers to get everything going in that aspect. And we were able many years ago to partner with a labs called Pioneer Labs, which is a small lab, and give us a special pricing, a cash-based pricing for the patients. And they do have 1 day a week for this. So we get blood work done on a weekly basis for them.
Oh, that's wonderful.
Also, we were able to verbally contract with Triumph Radiology, which is in town,
Okay.
for special cash pricing too for all imaging. So those are big support that we have for completing basically most of what we're going to do here with the patients.
Okay. And as far as the typical patients that you see here, are you doing well visits? Are you doing sick visits?
I will say both. We do well visits because we have a primary care settings where we see all these patients for their follow-up and all the condition, hypertension, hyperlipidemia, asthma, COPD, you name it, diabetes, all of them. Plus we have episodic patients come, with acute illness. We're trying to triage them, for the sake of the clinic. As especially after the pandemic. But yeah, we do both.
Okay. And what ages are usually accepted here?
We're trying to stay more on the adult side, but we do take care some children's with acute process, but not children for the wellness business or anything like that. We're trying to then recommend it just to go to the heart of Florida. They have pediatrician, the whole pediatric center, and go from there.
And what brought you to this clinic? Why do you come?
Wow. So I will say probably 10 years ago, I was in a friend's house party, and Sonia Torres, one of the pioneer founders, nurse of this clinic, approached me and say, hey, do you want to be part of the Guadalupana Clinic? And for the longest, I was just looking, who do I need to contact to be part of that? It's been on my soul to help and give. And she said, nothing, come this day. That's it, you're part of the clinic. So never gonna forget that first day, which was in the back office of the church. That where they located me. The fulfilling and how you feel after you see the appreciation of this type of patient is huge. It just, it's everything. It's everything of what we do when we do it with passion and vocation and what, when you love what you do. And I'm assuming you know what I'm talking about.
I do. I do. And the part where you're saying you were able to practice doing something that you love without having as much paperwork, as much responsibility for the non-clinical work, it sounds like a dream.
It is a dream. It is a dream because we are under the Marion County Health Department Southern Immunity, which is give us, the freedom of be more relaxed in what we do. And I'm gonna say this politically correct, and I probably hate it to say it, and I don't like that word either, but we don't have to practice defensive medicine. Because this is, we do what we do from the heart, and we try, there's no compensation in here. This is all volunteer. So, and it's you feel so good when you do that, and when you see the appreciation of the patients that you take care and how they appreciate what you do for them.
Wonderful. And what can our medical society, our Marion County Medical Society, or other physicians in the community, or other medical providers in the community, what can they do to support this clinic?
That is a great question, because it's what we lack in through the years, so specialties. Of course, we can get more primary care, because the more primary cares we get, providers can fulfill that position, the more we can serve. But in the specialty part, we hardly have many specialists to come over here. When we have dermatology have come in the past, gastroenterology came in the past, and so on. Even a surgeon, retired surgeon, came years back. But any specialty that can come in and be part of the clinic and give us a day, a month, a day, a quarter, whatever could be feasible, and can we work out, it'd be wonderful. It'd be wonderful to help, especially those specialties that are hard to come and find. There's not many endocrinologists there, not many rheumatologists there, and those are going to be difficult. But then we have plenty cardiologists. We got plenty neurologists. We got many of these specialties out there, pulmonologists, that can give us, a day at a quarter, a day at a month, or every other month, whatever it could be. Just come in here, give us maybe a couple hours. It's not the entire, the clinic works from 5 to 8 normally. But an hour or two, we're gonna have people scheduled specifically that will be referred from us, the primary care services, and see what they can do. Okay. And we can work that for them to be under the sovereign immunity cover from the health department. So should not be no risk of liability or anything like that. So I believe the Marion County Medical Societies can do a lot in that aspect, and the whole community. It's just about working for the community. One thing that I always said, I'm not from here, I'm a foreign, born in Puerto Rico, but I'm a kind of individual that where I am, where I work, where I live, that's where I'm from right now. And I'm from Puerto Rico, but who has given me the last 20 years of my life in Marion County. So I better do something for Marion County and be appreciative of what I have in here. And I think we need to put more people to serve this county for the well-being of the county in general.
No, I think that's very true. It's one of those things where when we're talking about charity, we need to think about who we are, what is our big gift, how can we contribute back to our community? And I think what you're saying is very wise. I do. Yes. So, yeah. Well, and then as far as patients, how do patients find you?
Well, the number one way is the church, the Blessed Trinity Church. In every church, every week, in every Mass, every week, they announce in the American and the Hispanic church the following clinic. And they specify this is the clinic for uninsured. So in the next day, so every week they're announcing this.
Gotcha. Okay. And it's open to anybody who's uninsured.
Anybody's on insurance. You don't have to be a member of the church at all. You don't have to be Catholic. You just anybody.
That's wonderful. Dr. Rubio, could you tell us a little bit more about what services are offered here?
Yes, I was forgetting about that. We have right now, since after the pandemic, we have dental services for adults more than and we have a dentist come every month in here, provide services of multiple type of extractions and treatment that they do. And it's been a wonderful services for the county.
Oh, that's wonderful. That's a very difficult to obtain
Very difficult, yes.
service.
Especially because of the expenses.
Yes. Yes.
Yes.
Who covers the materials and the equipment? Is that under the church?
It's under the church, and the actual dentist brings their equipment.
Wow.
Yes.
Thank you.
All right, so this is the lobby of the Guadalupana Clinic. As you can see, it's very open and comfortable. We have right now a few patients that are waiting to be seen right here. When we come around, we have the front desk, exactly right here to my right, where they check in and check out, okay? And if we move forward this way over here, we can see the other part of the front desk, which is the checkout. We have right here, Belinda, come on this way real quick. Belinda is our in charge individual of the clinic who make all the appointments, create all the follow-ups, keep the track of everything we do in the clinic. And if we move forward this way, this is gonna be where we have the exam room. We got over here the dental lab for the dental services. As you can see, they have all the equipment in here. Okay. And if we move to my left, you can see the dental department. We got in here one of the assistant, Chamila, right? Okay. And right now she's doing some services. As we come around, we have on the side over here, the medical examining rooms, and you can come and pick in through this one right here. So we got over here another room. We have here Anderson Gomez, a nutritionist helping us out, those patients, and he's also an occupational therapist that comes in here, help us out with the nutrition and diet for the patients. Well, I just want to say thank you to Dr. Harrington and Marion County Medical Society and Sherry for their services of what they do in the county and all for the physicians, and especially for being here and have the interest to know our clinic and know what we do and trying to help us in anything else you can guys offer in the future.
Well, thank you so much, Dr. Rubio. We had a great time visiting. Thank you so much.
Thank you.